Okay, happy Friday, everybody. Happy Friday, Dr. Miraglia. Nice to see you.
And you too. Yeah. Happy to be here.
Well, we are both really excited that we thought we'd just jump on and share our excitement with everybody because it's here. We have been asked about this course since we had our first mini residency, right? That's what
Yes.
everybody wanted to know. When's the next one? So here we are, almost 2 years later, but good things take time. Let's talk a little bit about the 2-day advanced mini residency. And first of all, let's just give a brief overview, and then maybe we'll dive a little bit deeper into day one and day two and what the attendee should expect. So why don't you just give us a brief overview
Sure.
of why we're doing an advanced course and what it's all about?
Yes. And so, yeah, the advanced course, it basically picks up where we left off in the children through teenage category. And so in our first course, we got the doctors started on expansion appliances that are in the fixed category, upper and lower, to develop the foundation. We basically taught them in like the safest risk-free zone for children is that 8 to 12-year-old category. Now, two components in the advanced course. We're going to be adding an expansive bracket and wire technique to that foundation technique. Now, the end result is that there are children whose permanent teeth in the mixed dentition, that 8 to 12 category, are really out of place. We're talking about 7, 8, 9, and 10, and of course, 23 to 26. Well, those teeth could use a little help as the foundation is developing. And so there's a wonderful bracket and wire technique that is expansive. And as we're using fixed expanders, we can incorporate a bracket and wire technique to continue the alignment of the teeth while the foundation is growing. So we've got a tremendous asset there to have that in our toolbox. So we're going to be teaching that entire system to be included kind of following the expander, delivering of the foundation, and then alignment of the teeth that are present. Then we're going to graduate to the guidance appliances that we teach from removing all of that. Now, the second big category we're going to talk about is from 12 to 17. The age of 12 to 17, it is absolutely possible to use fixed expansion appliances for, we call them at that age, teens. So 12 to 17, we've got these teenagers that we see. And yes, some of them walk in and they are 13, 14, 16. We don't get to meet them all at 8, which would be perfect. But if a 13, 14, 16-year-old walks in and you could see they either haven't had the correct attention or haven't had any attention early, there might be a need for fixed expanders first. And so we're going to teach a very nice fixed expansion technique that can be used all the way to the age of 17 in a very healthy, very safe, very conservative manner to develop the foundation first. In the end, the underlying philosophy is foundation first, teeth second, but we're going to expand our groups into that 12 to 17-year-old range using fixed expansion techniques. We're also going to work on that 8 to 12-year-old range where we can incorporate a bracket and wire technique that is expansive into our fixed expanders that we're developing the foundation with. And it's a really big opportunity to have all of the foundation developed, but at the same time deliver the placement of the teeth as well. It helps those children transition easier into the myofunctional guidance appliances that we're using until we can get to the permanent dentition. And it also helps a lot with the tongue space and then the bite. And then of course, friend and release myofunctional therapy, all of these things go hand in hand. Now, one component that's going to be an underlying theme through the entire program is going to be the development of a healthy child from an unhealthy child. Because every one of the kids that we're going to see is going to have medical symptoms that we are well aware of now. So whether it comes from their underdevelopment, their sleeping, their breathing, there's an issue where they're struggling with symptoms. So we're going to be covering pretty much every symptom you could imagine over the course of those days, all the way to and including the children who come in with their ADD, ADHD diagnosis. And some of those children are in the unmedicated category because they haven't gone that route yet. We're going to get them recovered to avoid medication, but we're also going to meet and treat children who are already on the medication, and that will be to full resolution, removing them from their medication, and of course, resuming a normal and healthy lifestyle after that, and having all of the advantages and none of the symptoms going forward.
And what makes your teaching style so unique is that you really walk through from start to finish. You're walking the walk, you're talking the talk, from placement to removal to retention to all the steps in between, through case studies. So you have case studies spanning over how many years now?
So this is my 18th year. And so it's a wonderful opportunity to see results that are way out there, because we're going to show you children who are already at this point either in college or out of college, where they have wisdom teeth that have erupted. Because when we're talking about foundation first, teeth second, ultimately the goal is to develop the foundation enough to have 32 teeth come into place and function. Not to mention the fact that we'd like to see the early children who are struggling in all the symptom categories, including academic, turn into someone who could go through college and become an engineer of all things. And so the idea is we're going to see children not just today, because we have very current things to show, and then we also have children who are college age or past that we got to treat a long time ago, and we can share with you the results of where they are, how stable they are, and basically how asymptomatic they've been for now more than a decade, let's say.
And that's so rewarding. We're also looking forward to include our alumni case share showdown, we're calling it, because now we have Airway doctors that are trained by you that have been doing this for 2 years. So that'll be a really exciting segment as well, kind of to see all the children and adults that have been helped through your teaching. So that's also a very social and fun part of the Learn as well. So when will this take place? Well, this will be October 1st and October 2nd. And I think I can speak for you as well, Dr. Miraglia, is that we're really excited to give a live Learn finally. So it'll be live in Tyson's Corner, Virginia at the Marriott. So I will send out more details as we get them. But you can also attend via a live stream. So we have two options. So all of our bases are covered, and we really do hope that you DM us to be included in our exclusive mailing list, because this course will sell out. We have a limited availability due to the COVID precautions that we will be taking. So we already have a quarter of the attendance filled out from our alumni who have already registered. So please, if you're serious about taking our course, DM us and we'll get you on our exclusive mailing list to give you the opportunity to join. Dr. Miraglia, do you recommend, or is it a prerequisite for them to take our mini residency? And if it's a recommendation, can you ask kind of what qualifications they should come into the advanced course with?
Sure. Yeah, the best case scenario would have been to have already taken the AHS pediatric program, because then you would have spent the day learning all of the diagnostics and all of the treatment options, the biggest one being the fixed expansion technique. Having a background in fixed expanders, upper and lower, to develop the foundation is a really good thing to bring into that course, because when we hit the ground running on that October course, we're going to be learning to include an expansive bracket and wire technique into the fixed expander technique for the kids who have these displaced teeth that we want better aligned. And so to come in without a fixed expansion technique is going to be a little difficult. And the idea is not to have to teach that all again during that course. So it would be nice if they did have the pediatric course behind them as a prerequisite. I don't know if we want to call that mandatory, but certainly you'd be in the right space to then jump in and hit the ground running, because we're going to pick up where we left off and move forward. And then one point of clarity I'd like to make for the attendees, a lot of people know me and they know, and they have heard, yes, braces are bad and don't use braces. And generally braces are retractive and use distalization and keep you narrow. That's very accurate. Braces are a tooth-focused technique. However, there is a very specific bracket and wire technique that is an expansive technique. And so that's the one I have been using now for, this is the 17th or 18th year. So I have been using brackets and wires for 17, 18 years, but never alone. In other words, they go into children who have the foundation developed, and we begin that process while the expanders are in place. So we're going to learn how to include an expansive bracket and wire technique that only helps you go in the direction we'd like to go, wider and forward. So you're going to learn very specifically, how do you take a bracket and wire technique and use it in an expansive philosophy and add it to your foundation first, teeth second? So yeah, that's just a little point of clarity, because I know I'm the one out there saying, look, braces not so good. That's when braces are used alone to address teeth without ever paying attention to the foundation, the breathing, the sleeping, the growth, the development. Then braces can be trouble. And then we struggle with those. And of course, things don't have stability, blah, blah, blah. But the idea is you're going to be really surprised to learn that there's actually a way to use brackets and wires and continue to grow the jaws with those. And that's a special thing to learn. And so I'm ready to share that. I can't wait to share that. Wait until you see what you can do.
Well, we're excited too, because then we can help more patients breathe, sleep, and thrive, which is our motto, as you know. So, well, thank you for your time. I think we'll just make this short and sweet. You gave us really all the details that we need because you do such a great job of simplifying the process that we are confident that this will be something that you can implement and integrate Monday morning after our course, like all your other courses. So thanks for taking the time, and thanks everyone for listening. And please feel free to DM me with your email to be on that exclusive list or DM me with any questions. Thanks again, Dr. Miraglia, and we'll see you soon.
My pleasure. Thank you very much.
Thanks.